Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus-Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus-Webb. Glad you all could join us once again, both for our radio audience here in Mississippi and our online audience tuning in through iHeartRadio. We're glad you all could be with us as well. Well, you have only to turn on the news these days to see that one of the big issues that we are now facing and discussing is health care. Even before the pandemic hit, millions of Americans lacked critically needed health insurance. Now, with businesses struggling to stay afloat, with millions more are at risk of losing their employee-sponsored insurance, that could lead them to have to navigate the marketplace on their own. Well, we're really excited to welcome Patrick-Quigley to our program today. Patrick is the CEO and co-founder of Sidecar Health. He's going to share with you guys some money-saving and user-friendly options that you all can find through Sidecar Health. I had a chance to visit the website. We're going to let you guys know how to do the same thing. Patrick, thank you so much for the time. Really appreciate it.
Hey, thanks so much for having me on.
Hey, glad to do it. So, Patrick, we're going to get into the website here in a bit, but as I mentioned, health care, health insurance are one of the things that really is on the mind of so many. How has COVID-19 impacted health insurance in the country, Patrick?
Well, it really should be on all of our minds. Like, even before COVID, the U.S. is going through a healthcare crisis. We've got almost 30 million people that are uninsured. We've got even more than that are underinsured. And, the pandemic has just made everything worse. People need access to care right now, but we're losing jobs. And a lot of times when people lose jobs, you lose your access to your health insurance. So people are trying to figure out, how do I get covered? And, the way that we think about it is launching a product that's super unique that allows people to, enroll at any time. Because I think that you would agree that, everybody deserves the right to access health care, especially now.
Right, exactly. And this is where I think what Sidecar Health is doing is so unique. So talk to us about the different models then, Patrick. So you have the cash price model versus what we see today. Talk to us about how the cash price model, how it benefits the members.
Yeah, it is completely unique. So what most people don't know is you can actually pay your doctor with cash or pay your pharmacy with cash. Sometimes this is called self-pay. You may have heard that term. So we've done a lot of academic research on this, and it turns out, on average, it's about 39% cheaper to pay for care with cash than what your insurance company might pay for that same care. And so, that is just a tremendous amount of savings if you think about how big healthcare bills are. And so we've designed a health insurance product around that concept because if the cost of care is lower, then the cost of the insurance is also lower. Like, our view is that we can empower consumers to become smart shoppers of healthcare. We give them a Visa card, a Visa debit card that enables them to buy care directly with the doctor and access to lower prices, while at the same time we also give them the information they need to make purchase decisions, letting people know what care should cost, what the plan pays. Because if we can turn, everybody from being just a patient into an informed purchaser of care, we can lower the cost of care for everyone.
I love that. And I love that you guys share a bit of the backstory about the research you all did when it came to Sidecar Health. I want to talk to those. I mentioned that, of course, even before the pandemic, that there were millions that didn't have the health insurance that they needed or didn't have enough. But there are those, Patrick, that I also mentioned that, and we hear it in the news even this week, who are, at risk of losing their employer-sponsored insurance. So when it comes to a plan like Sidecar Health, talk to us about how those who may be in that situation, how they can still be able to get high-quality coverage.
Yeah, that's a great question. So if you've lost your health insurance as part of losing your job, let's say in the last 60 days, that is technically what's called a life event in the healthcare industry, and that leads you access to healthcare exchanges. And the reason why that's important is through the exchanges, you may qualify for a subsidy. Because really, as you know, like healthcare and health insurance are expensive. So if you qualify for a subsidy, it's a good idea to take advantage of it. Because at the end of the day, healthcare is all about, what can I afford? What is right for my family? And so the way that we fit in there is that we've created a product that allows consumers and people to customize their coverage for exactly what they need. Because healthcare is not one size fits all. So you can come to us and you can determine how much coverage you want to buy. You can even design the features of the plan. Like maybe you want to turn on or off prescription drug coverage. So really, like, our vision is that people need to get coverage. They need to get it when they need it, and they need people to design something that fits their budget.
Right. And when our audience to go to sidecarhealth.com, when they go there, they're able to fill out information about themselves and their family in order to be able to calculate to get a custom quote. What I want to ask you about the last thing, Patrick, that has to be a good feeling for you are the testimonials. How does it feel to know that you're not only able to help people to save money, but also give them the health care that they so need?
Yeah, no, I appreciate you bringing that up. Like, we are a people first, a member first company, and we're really proud of the fact that the feedback that we get from our members is really, really positive. You can go online and search our reviews, and you'll see it firsthand. We get great feedback that people that are coming to us have been able to access care for the first time for their families. And really, as a mission-driven company where we're trying to make health insurance and healthcare more affordable for everybody, it's really powerful for us to see it in action and feel like we're really doing a lot of good.
Well, you definitely are, and it's something I'm glad to be able to share with our audience. Again, everyone, Patrick Quigley has been our guest. He's the CEO and co-founder of Sidecar Health. Make sure you guys visit, again, sidecarhealth.com. For our radio audience, we'll put this on our Facebook page, and for those joining us through iHeartRadio, we'll make sure to put it in the notes for our podcast. Patrick, thank you so much for the information. I really appreciate it, and looking forward to having you back on the show again.
All right, well, thanks for having me.
A pleasure is definitely all mine, and we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus-Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Let's make today amazing. Take care.